Hello everyone, welcome to Jessie's MedBio. In today's section, we are going to learn about child health nursing. I'm using simple explanations and I'm focusing on important exam points and also I'm trying to give some easy memory tips. Before we begin, make sure to subscribe to Jessie's MedBio on YouTube and follow Jessie's MedBio on Instagram for notes, MCQs and study updates. So, the first chapter in child health nursing is Introduction Modern Concept to Child Health. So it's a vast chapter, so I plan to make it into part. And so today I am going to take three topics. This is the first three topics in this chapter. So first one is historical development of child health. Second one is philosophy and modern concept of child care. And third one is cultural and religious consideration of child care. So, before entering into the topics, I am just giving an intro about the term that is pediatrics. We all know or we all heard about this term. Pediatric is a word which is derived from the Greek. So, they divided this term into three, that is pedia, hyatry, and ix. Here, pedia means child, and hyatry means treatment, and ix means branch of science. This about the pediatrics. So, now you get an idea about the term pediatrics. So, now I am going to explain about the definition. So, pediatric is defined as the branch of medical science that deals with child development and care and with the diseases of childhood and their treatment. As I already told, it is a branch of medical science and it is mainly focusing on the development and care of the child. The age limit is from 0 to 18 years. These age group children are coming under the pediatrics. And also they are focusing on the childhood diseases and what all are the treatments are there for each diseases. These things they are focusing. Mainly they are focusing on the child development and care and also the childhood diseases and their treatment. So, next is the pediatric nurse. As a nurse, it is very essential to know about what is pediatric nursing. So, pediatric nursing is a branch of nursing concerned with care of infants and children. It focuses on providing care to infants, children, and adolescents. The goal of pediatric nursing is to foster growth and development of the child and promotes optimum state of physical, mental, and social wellness. Here also they are telling the same thing. Pediatric nursing means they are mainly providing care to the infants, children, and adolescents who is coming under the age limit of 0 to 18 years, and also their goal, the goal of pediatric nursing is to provide proper growth and development to the child and also to promote an optimum state. Optimum means a balanced state of physical, mental, and social wellness. That is about pediatric nursing. So now I am entering into our topic, that the first one is historical development of the child. Historical development of the child means how the child care has evolved over the centuries. So many milestones they covered, and here it starts from 225 BC. During 225 BC, so in Susruta Samhita, they were mentioned about the breast milk and child hygiene. It was the first innovations which is coming under the child care. After that, during 370 to 460 BC, the father of modern medicine, that is Hippocrates, he described about the childhood diseases. After that, during 6th century, the Kashyapa and Jivaka, they were known as the first Indian pediatricians. They explained about the child care and childhood diseases. After that, manuscripts were formed, that is Kashyapa Samhita and Susruta Samhita. The manuscript means it is an original handwritten document. In that document, they are explaining about the child rearing, infant feeding, and about the Ayurvedic treatment. The child rearing means how we are caring the child or how we are guiding a child from infancy to adulthood. That type of things are coming under child rearing. After this manuscript, the Charak wrote about the newborn care. Then during 850 to 923 AD, the Rhasis wrote first book on diseases of children. After that, in 1472 AD, first pediatric book was printed, which is in Italian language. Then during 1545 AD, the Thomas Fair wrote first English book on children's diseases. Then during 1802, the first pediatric hospital was established in Paris. It was the first pediatric hospital which was established in Paris during the year of 1802. Then during 1860, Dr. Abraham Jacob, he is known as the father of pediatrics. This is an MCQ question. The father of pediatrics is known as Dr. Abraham Jacob. He started first child clinic in New York. After that, in 1888, in Harvard Medical School, they started a department for pediatric. Then in 1920, a Indian league was formed that is known as Lady Chelmsford All India League, which is mainly focusing on the promotion of maternal and child welfare. These are the important historical development which is happened in the child care. That is the first topic. Next we are moving on to the second topic, that is philosophy of child care. The philosophy of child care means the principles that guide nurses in caring for infants, children and adolescents. Here the philosophy means it is a principles which helps the nurses to or which act as a guide for the nurses to provide proper care to the infant, children and the adolescents. Here they are mainly focusing on four things, that is protecting and promoting health, preventing illness and injury, treating disease and reduce sufferings. So under the philosophy we can able to see two major philosophies, that is family centered care and atraumatic care. So the first one is family centered care. Family centered care means the healthcare members who are taking care of the child involves the family members or the parents also in providing care. Under this some points are coming. So the first one is family is the constant in child life, which means family is the only one factor which is existing as permanent in child's life. All the other factors such as the nurses or the doctors or pediatricians all can vary, but the family will not change. Then second one is parent professional collaboration in planning and providing care, that I already explained, which means parents and the healthcare members are working together to provide care to the children. Then respect family diversity, which means the diversity, the culture, the religion, racial, then ethnicity, then socio-economic factors. All these things will be varying from one family to another family. So we should respect their diversity. Then recognize family strength and different coping methods. Our responsibility is to recognize the strength and weakness of the family members, and also we have to identify their coping methods also. Then share honest and unbiased information continuously with parents, which means while we are giving an information regarding the child condition or the about the treatment, at that time we have to give a proper and correct information to the parents, We should not give an biased information. Then consider the developmental needs of the child and family. It is our responsibility to consider, or our responsibility is to focus on the developmental needs, and according to that we should work. Next one is provide continuous care until services are no longer needed, which means it is our responsibility to provide continuous care to the child, and we should stop only after the child is recovered completely. Till that time we have to give the care. Next one is offer high quality health care, which means while we are providing the healthcare services, we should give an high quality care during the assessment time, treatment time, or the recommendation or referral time. Next one is provide comprehensive support, which means we have to give an comprehensive support in all the levels, in medical, educational, emotional, therapeutic, and financial. Then encourage family to family support, which means it is our responsibility to help the families to support and connect with other families who is having similar experiences. Then respect the family's right to accept, refuse, or postpone services. The family has the right to accept or refuse a treatment or postpone the services. So it is our responsibility to respect their rights. Then plan care according to family priorities and needs, which means while we are planning a care or while we are planning a procedure, at that time we should give priority to the family members and to their needs. Then last one is provide accessible and flexible services for maximum family participation. When we are giving the care, it should be accessible and flexible to all, and also make sure that it is an affordable service also. After that, we can able to see two major concepts which is coming under the family centered care, that is enabling and empowerment. Enabling means help families to develop knowledge, skills, and confidence to care for the child, creates opportunities for families to use and improve their abilities. Here they are enabling the family members to improve their knowledge or skills or confidence to provide proper care to the child. The next one is empowerment. Empowerment means helps families to gain confidence and control over decisions related to their child care, encourages family to recognize and use their own strengths and abilities. Here they are mainly focusing on, or they are empowering the family members to make an informed decision or take a proper decision about the child care. Enabling means they are enabling the family members to provide proper care to the child. Empowerment means they are empowering the family members to take an appropriate decision about the child care. That is about the family centered care. The second philosophy is atraumatic care. Atraumatic care means it is the care given to children that prevents or reduces physical and psychological stress during illness, hospitalization, or any medical procedure. Which means here they are mainly focusing on to prevent and reduce both the physical and the psychological stress. The physical stress means the pain or lack of sleep or the loud noises and all. Then psychological means the anxiety, fear, anger, sadness, all will come. They are focusing on to prevent these physical and psychological stresses during the illness time or the hospitalization time or while doing any medical procedures. Here the main goal of the atraumatic care is first, do no harm. We should not do any harm to the child. That is our first goal. Then under this we can able to see components and principles. Under the components, 4 elements are coming, that is therapeutic care, personal, setting, intervention. Therapeutic care means the care which we are giving to the child, which is preventive, curative, rehabilitative, palliative care, all will come. Then personal means the person who is taking care of the child. Under the doctor, nurses, physician, family members all will come. Then setting. Setting means the place where the child is getting the treatment, in home, hospital, clinic, or other healthcare facilities. The last one is the intervention. Intervention means the medical procedure we are doing. Next is principles. Mainly three principles are here. So first one is prevent or minimize the child's separation from the family, which means how we can prevent or minimize the separation means we have to encourage the family members to involve in child care, and we have to encourage them to spend more time with their child. Thus we can able to minimize the separation. Then promote a sense of control. Promote a sense of control means we have to encourage the children's participation also, and also we have to explain the procedures to the children according to their age level or according to their understanding level. We have to explain the procedure. And then prevent or minimize the bodily injury and pain, which means we have to provide some pain relieving measures, or while we are doing any procedures we have to do it gently, and also we have to avoid unnecessary invasive procedures, avoid doing unnecessary invasive procedures. So next one is modern concept of child care. These are the changes in pediatric care. So under this some 10 points are coming. So the first one is in earlier times they are focusing on the diseases, which means they are giving the disease centered care. But now in the modern concept they are providing child centered care. So next one is in earlier times they are giving very less attention to the female children, but now they are giving equal and special care for the female child, because they are considering the girls as the future mothers. And the third one is during the earlier times they started to giving care to the woman only after she became pregnant, but now the care begins before the conception itself. uh, they are providing proper health education regarding the parenthood, and also they are providing proper maternal health. And next one is during the earlier times they are giving special care to the sick children in the hospital, but now from the day of conception to throughout the developmental years of the childhood they are giving the comprehensive care. Then that is the fourth one. Then fifth one is in earlier time they are providing care only to the physical problems, only the physical problems were treated, but now they are focusing on, or they are providing physical, emotional, psychological, social and spiritual care to the children. Then next one is in earlier times they are focused on the illness oriented care, which means the treatment was given only after the illness occurred. But now they are focusing on the health promotion, which means they are focusing on the prevention of diseases. Then in earlier times the parents are not allowed to be with the child in the hospital, and also the visiting hours is very less. But now they are allowing the parents to be with the child, and also they are providing proper flexible visiting hours. And then that is the seventh point. Then eighth point is in earlier times they are focused mainly on the cleanliness and the treatment, but now along with the cleanliness and the treatment the healthcare provider is giving love, comfort, emotional support and the reassurance to the child. Then during earlier time they are only providing the routine care only, routine nursing care they are providing, or assessing, treating, that care only they are providing. But now they are, the healthcare members are providing quality care in terms of play or proper nutrition, recreation or developmental support. In all these areas they are focusing and providing proper quality care to the children. Then the last one is in earlier times they are mainly providing care based on the traditional practices, but now they are providing care based on the scientific research and evidence, and which is more safe and efficient. This is all about the modern concept of child care. So our last topic is cultural and religious consideration. So first one is the culture. Culture is the way of life shared by a group of people. As we all know, culture is differ from one group to another group, which includes the values, beliefs, customs, traditions, behaviors, and practices. These all elements will vary from one group of people to another group of people. And also, we know that the culture is learned and passed from one generation to next generation. And the importance of cultural consideration in childcare is makes every child unique. Which means, for example, if you are taking a classroom, in that 50 students are there, and each students are having different culture, and also each student is unique in its own culture, right? Then children learn their culture from an early age, which means the child can able to learn about their culture from their earlier age itself. Then they often believe their own culture and practices are normal or correct, and also they can able to believe their own culture is right or wrong. They can able to identify. That is about the culture. Then religion. Religion is a system of spiritual beliefs and practices influenced by the culture. Religion means it is a spiritual belief and practices which also influenced by the culture. The importance of coming as the religion helps the child to develop their moral values and also helps to develop a good relationship, and also helps them to make a proper lifestyle decision, and also improving their coping ability and also their emotional ability. And if misused, the negative effects will also come. Religion is a positive thing, and if you are misusing that, the negative effects will happen, which means may discourage preventive health care or medical treatment. Which means in some religion or in some culture they are saying that do not take vaccination, which because of that they are discouraging the preventive health care, right? Then they promote or allow harmful or abusive practices. Some harmful practice in certain cultures, they are following some harmful practices. So it will get or it will cause harm to the child's physical well-being and also to the emotional well-being. These about our three topics. Today we discussed about the historical development, then philosophy, then modern concept, and at last cultural and spiritual consideration. Thank you.